Isang malusog at mapapalang hapon po sa lahat ng nakasubaybay ngayon sa ating Kapihan with Media via DOH Facebook at YouTube pages saan mang bahagi ng ating bansa. Ang inyo pong lingkod mula sa Kagawaran ng Kalusugan, ako po si Lynn Legarteja na nag-aanyayang halika na't makinig, makibahagi at matuto sa mga eksperto ng kalusugan. Pero bago po tayo opisyal na magsimula, let me first read our house rules. To ensure the smooth flow of this session, everyone is encouraged to first, use the naming convention below for Zoom usernames to ensure proper acknowledgement. Second, pay attention to the discussion of our health experts and or resource persons. Third, keep your microphones muted while speakers are discussing and presenting. Fourth, should you have questions, participants shall signify and send them in the Zoom chat box and wait for the host to acknowledge them. There shall be an open forum after the discussion, and submitted questions will be addressed first by our experts, followed by the Zoom chat box questions. Every participant is also advised to reserve your questions. Only questions related to the topic discussed will be entertained. Lastly, please join the Kapihan until the last part of the session. Para sa ating Kapihan with Media, ating pong tatalakayin ang World Prematurity Day. Sa mga hindi pa po nakakaalam, ating pong ginugunita ngayong araw ang World Prematurity Day. And to discuss the prevention, treatment, and awareness on prematurity, we are blessed to have with us today Dr. Maria Esterlita V. Uy, the President of the Philippine Society of Newborn Medicine. Good afternoon, Doc.
Good afternoon,
Good
Lynn.
afternoon po. You may take away the virtual floor.
Okay, thank you. Thank you for having me this afternoon. So good afternoon, everyone. I am Dr. Maria Esterlita Uy. I'm currently the president of the Philippine Society of Newborn Medicine and also the Assistant Division Chief of Newborn Medicine at the Philippine General Hospital, University of the Philippines. I will talk about improving survival of the premature infant. So premature or preterm infants are those babies who were born before completing 37 weeks of pregnancy. Worldwide, 1 out of 10 babies are born premature. So the problem is not really just the small size, but the complications associated with prematurity. These are babies may be born gasping, blue, with difficulty of breathing. So that's why we have to help them right away. Because of their compromised immune system, they have a higher risk of infection. Their brains are very fragile, so there is really a risk for bleeding. They are unable to feed well, and they are unable to keep normal body temperature. They may have abnormal growth of the blood vessels inside the eye, which is called retina, that may lead to blindness. And with all these complications, the baby may be at risk of developmental delay during childhood. We all know of the Sustainable Development Goal 3, which is good health and well-being. But SDG 3.2 is ending preventable newborn deaths and stillbirths. In this slide, you will see that 2.6 million babies die in the first month of life every year, and the leading cause is prematurity. What is important in this slide is that 75% of newborn deaths can be prevented with high-quality care. So what is the situation here in the Philippines? In 2010, the Philippines ranked 8 of 10 countries contributing to majority of preterm births worldwide. At the same time, it ranked 7th for the highest total deaths due to complications from premature births. As of 2020, with WHO estimates, complications from prematurity comprise 42% of all neonatal deaths in the Philippines, making it the #1 cause of neonatal death. So what are the approaches that we can do in reducing premature births? It should start with care even prior to the pregnancy. All women of childbearing age may need to practice family planning in any form, and there should be education on good nutrition and healthy lifestyle. Once the woman becomes pregnant, there should be close monitoring of her pregnancy. There should be screening of high blood pressure, diabetes, and risky lifestyle that can lead to increased risk of preterm births. Once these women are identified, there should be much closer and extra care during the pregnancy. If the mother comes in or the pregnant woman comes in preterm labor, this is very important because there are interventions that could actually improve preterm survival. This is the administration of antenatal steroids, which will hasten maturation of the lungs so that the babies, even if premature, may need lesser respiratory support. Magnesium sulfate is also recommended because this has been found to protect the preterm infant's brain. There is lesser cerebral palsy and there is lesser brain bleeding. In case the woman's bag of water ruptured for more than 24 hours, antibiotics should be administered since the preterm baby may come out already infected. There are medications that can slow down the labor to be able to extend the pregnancy some more. At the same time, this medication would allow the health provider to have time to give the antenatal steroid, the magnesium sulfate, and the antibiotics, as well as transfer the woman to a health facility that is capable of caring for preterm infants. Once the preterm infant is born, what are the approaches that we can do to improve their survival? As mentioned earlier, they should be delivered in a health facility capable of caring for premature infants. That means there are trained personnel in newborn resuscitation, there are available equipment for support of breathing, and as I've said earlier, it is safer if the women are transferred prior to delivery instead of the women being delivered in a lying-in center and then the sick preterm infants being transported to a different hospital. There should also be an increased attention to keeping the infant warm. One intervention is kangaroo mother care, which I will discuss later. There should also be attention in assisting the mothers in providing breast milk to their baby. If breast milk is the best nutrition for all infants, this is more so among preterm infants. The composition of breast milk of a mother who delivered a preterm infant has higher nutrition, higher fat content, protein content, and micronutrients, which will help the preterm infant. The preterm infants may not be able to directly breastfeed to the mother, so that we have to assist the mothers in expressing their breast milk, which can be given to the preterm infant. As mentioned, preterm infants are at a higher risk of infection, so that there should be extra attention to hygiene, such as hand washing. It is important that the preterm infants remain in the hospital because there should be close or extra attention to danger signs, and the hospital facility should be capable of managing them. In this table, you will see that each intervention can lead to significant percent of deaths averted, as you can see with family planning, antenatal steroids, antibiotics for rupture of membrane, just an immediate assessment and simple care of all babies, adequate neonatal resuscitation, ensuring that the baby maintains normal temperature, kangaroo mother care. If these are all implemented together, you can actually save to almost 1 million preterm lives. I would like to talk briefly on kangaroo mother care in the Philippines. Kangaroo mother care is provided to preterm and low birth weight infants or infants whose birth weight is less than 2,500 grams. KMC is a low technology, high impact intervention in saving premature babies' lives. Currently, we have more than 100 DOH hospitals and additional private hospitals implementing the KMC program. Kangaroo mother care can be provided for at least 8 hours a day, which is called intermittent KMC, or at least 18 hours per day, or what we call continuous KMC. Actually, other family members, especially the husband or the father of the baby, can help in providing KMC. Now, what are the benefits of KMC? As you can see here, it can decrease neonatal deaths by almost half. It can decrease the incidence of neonatal infections by almost half. There is faster weight gain and growth, higher breastfeeding rates, facilitation of mother-infant bonding. All these will lead to shorter hospital stay and lower hospital costs. So how do we position the baby in the KMC? Here in the Philippines, we use the elastic tube blouse. So we place the baby between the mother's breast in a frog-like position with the head turned sideways. And then we pull up that tube blouse, or what we call the KMC blouse. With this, the baby is held snugly and safely and is well thermoregulated, meaning the temperature is regulated. Now, KMC not only includes the kangaroo position, which is the prolonged skin-to-skin contact with an infant in a prone or vertical position, but it also includes breastfeeding, either by direct breastfeeding or alternatively by cup or tube feeding of the express breast milk. Also, this includes earlier discharge of the preterm infants and a very close follow-up with the infants provided. Studies have also shown that KMC is safe and effective in transporting the premature infants inside and outside the hospital. So in case you do not have any transport incubator, even if you have one, transporting the infant to another hospital, to another part of the hospital using KMC, there has been found that the baby remains with good or normal temperature and really and tolerates this KMC transport. In a study in Ilocos Training Medical Center and Regional Hospital, they can actually transport infants 40 kilometers away in other district hospitals, being transported to their hospitals in the KMC position. KMC is usually provided to preterm infants who are already stable, meaning around 3 to 7 days of life. However, a recent study by WHO showed that starting the KMC within 2 hours of life from birth, or 2 hours from birth, will further increase survival. That is why in 2022, WHO recommends starting KMC within 2 hours from birth to further increase preterm survival. I would like to talk about the advocacies of the Philippine Society of Newborn Medicine, which is an affiliate of the Philippine Pediatric Society. In our hope or in our advocacy to improve preterm survival, we actually trained more than 2,000 health providers in newborn resuscitation, which include KMC and breastfeeding support topics. In collaboration with DOH, WHO, and KMC Foundation Philippines, we have also trained more than 1,000 health providers in the care for the small baby program. This would be focusing on preterm and small birth weight, low birth weight infants. We have also collaborated with the Philippine Academy of Ophthalmology to develop guidelines on screening premature infants for retinopathy of prematurity. This is an important problem because if with severe forms of retinopathy of prematurity, the baby may go blind. There are also provisions of relevant guidelines on infection control, on management of infants born to COVID mothers, all these to help improve the survival of preterm infants as well as term infants. And with the DOH approval and support, there is a planned distribution and training on CPAP machines which are used for preterm infants in respiratory distress or with breathing difficulty. This is for distribution to district hospitals in the Philippines. This is in conjunction with the goal of the Every Newborn Action Plan that around 80% of district hospitals should have a CPAP machine. And with DOST, the society embarked in a research on screening for jaundice among Filipino infants, and this condition is actually more common among preterm infants. Most of our members who work in the different DOH hospitals may have encountered also the Philippine-made newborn mechanical ventilator. This is a low-cost ventilator, which are also used for newborn infants. For all the discussions I have done, all the efforts that have been done are aimed to achieve the SDG 3.2 goal in the Philippines, that is, by 2030, end preventable deaths of newborns and children under 5 years old, with all countries aiming to reduce neonatal mortality to at least as low as 12 per 1,000 live births, and under 5 mortality to at least as low as 25 per 1,000 live births. So that I enjoined everyone to really advocate for improvement in preterm survival to be able to achieve the SDG 3.2 goal here in the Philippines. So thank you everyone for listening.
Thank you very much, Doc Uy. Maraming salamat po sa pagbabahagi sa ating mga kababayan kung ano po yung premature birth, what approaches can we do to improve the survival of the premature baby, and also ways to reduce premature births. Thank you also for sharing with us yung mga advocacies of the Philippine Society of Newborn Medicine to address the premature births. Tayo naman po ay tutungo ngayon sa ikalawang bahagi ng ating kapihan kung saan atin naman pong tatalakayin ang mga programa, datos, at ating mga campaigns o kampanya as we celebrate the prematurity in the Philippines. And to discuss all this, please help me welcome Dr. Christine M. Guzman, the neonatologist from the Philippine Children's Medical Center. Good afternoon po, Dr. Guzman.
Good afternoon, everyone. Wait, I'll just share my slides.
Sure po.
There, is it clear?
Yes po, Doc.
Good afternoon, everyone. I'm Dr. Christine Guzman. I'm one of the neonatologists at the Philippine Children's Medical Center. And today I'm tasked to discuss on the national programs, data, and campaigns on prematurity in the Philippines. In 2020, 5.3 million children died before they reached their 5th birthday. So majority of this, around almost half of it, are the neonates. So they are the infants born, they are 0 to 28 days old. So in compare with the other data in 2000, it's actually we are in a better position because in 2000, the data showed that there's 9.9 million children died before they reached their 5th birthday. So there is a decline in the number of under 5 mortality rate from 75 deaths per 1,000 live births in 2000 to 38 deaths per 1,000 live births in 2019. So even though there's a decline, we're not still happy because despite of this effort, the goal is the target should be at least 25 deaths per 1,000 live births by the SDG 3.2. So here's the global causes of the under 5 deaths in 2019. A majority of it are the preterm births, followed by intrapartum related events, and lastly followed by congenital anomalies. So as you can see in the pie chart, it showed that majority of the under 5 deaths were neonatal births, and a big chunk of it are actually preterm birth complications. This is actually a 2010 data showing the Philippines having one of the highest small for gestational age infants born in 2010. So we're in top 8. However, the latest data showed already that there is actually a decrease in the preterm birth rate in the Philippines. We have now around 7.7 preterm birth rate, in contrast to previous data of 13.3% in 2014. So the newborn mortality rate is at 2.3, and there's an annual reduction in the newborn mortality rate from 2000 to 2021 by 1.4%. Low birth weight incidence in the Philippines was 11.9 in 2020. And however, even though we are achieving our goals, it is shown that Metro Manila has the lowest low birth weight rate at 9%. However, other two regions in the southern Philippines had the highest low birth weight rates, stated as Davao and Zamboanga. So this just explained the health inequalities that prevail in the country. So in the Philippines, increased antenatal care utilization, essential newborn care, and kangaroo mother care have decreased the adverse birth outcomes and neonatal mortality. So this is just a picture showing the estimates cost of death from 2000 to 2020. This data was generated by the World Health Organization and the Maternal and Child Epidemiology Estimation Group in 2023. It just showed that majority of the neonatal deaths is still prematurity at 42%. This is actually a 2020 recent data. So there's also a data under the UNICEF showing that in 2000 compared with 2021, the under 5 and the neonatal mortality rate slowly decreasing. So what are the programs that are the DOH is being implemented? So there are national programs on maternal and newborn health in the Philippines. So this was promulgated through the DOH administrative orders, the policies of care guidelines, Philippine Health Agenda, and the most recent is the law of the Republic Act of 1184, which is Kalusugan at Nutrisyon ng Magnahinay Act of 2018. Which supports the UNICEF program on the first 1,000 days. So there are other programs mandated also by the Department of Health. So this includes the planned Universal Healthcare Law in the future, and the Human Health Resource Deployment Program of the DOH, which would ensure the availability of healthcare workers up to the level of the barangay through the Barangay Health Worker Program. There is also the National Nutrition Council, which is in support of the well-being and the nutritional health of infants and children in the community through the Barangay Nutrition Scholar Program. Also, the Department of Health, in collaboration with the PhilHealth, devised the PhilHealth Z benefit package for premature and small newborns. This is the Circular 2017-009. Which was launched in 2017. So this aims to ensure the delivery of quality of health service for mothers who are about to give birth and improve the survival, health, and well-being of preterm and low birth weight babies. So for this package, so for 24 to 32 weeks fetal age, the Z benefit package range 35,000 to 135,000. And for those 32 weeks to less than 37 weeks, the coverage of PhilHealth would be around 24,000 to 71,000. So the PhilHealth would emphasize that the C benefit package may be availed by members and their legal dependents to accredited hospitals nationwide. So currently, there are only 24 hospitals who are accredited for the PhilHealth Z benefit package. So there are 9 hospitals in the National Capital Region and other regional hospitals in the country. So the WHO also in collaboration with the Department of Health, they joined forces into promoting the interventions to improve preterm birth outcomes. So that is administration of antenatal steroids, giving tocolytics to prevent preterm delivery, magnesium sulfate to be given to the mother if the baby is at less than 32 weeks, antibiotics given to the mom, and given the optimal mode of delivery, and also promoting kangaroo mother care and early CPAP for preterms with RDS, and surfactant administration for those infants with respiratory distress syndrome and oxygen therapy. So also the DOH launched the Unang Yakap or EINC program. So it is a 4 time-bound interventions that skilled health professionals must perform right after you deliver the baby. So this includes immediate and thorough drying, early skin-to-skin contact, properly timed cord clamping, and non-separation of the newborn from the mother for early breastfeeding and initiation and rooming in. So one of the component of the EINC is skin-to-skin contact, which is kangaroo mother care, which was discussed already by Dr. Uy. So the benefits of kangaroo mother care would be better weight gain, decreased risk for infection, causes improved maternal and family and infant bonding, increased and sustained breastfeeding post-discharge, maternal and family empowerment, a decreased cost of care, and health maintenance. So I'm from the Philippine Children's Medical Center. So as we know, this is one of the government-owned and controlled corporate national centers for specialized healthcare under the Department of Health. So our hospital is also tasked to be designated by the Department of Health as the National Referral Center for Neonatal Care. So the division continues to provide the highest level of neonatal care to critically ill newborns and strive to discover new knowledge, bring innovation and technology into the NICU, and all to improve the quality and the outcome of neonatal care. So it's just not overview per hospital of our NICU. So today is November 17, which is World Prematurity Day. So this picture was taken in 2022 when we celebrated the World Prematurity Day in our hospital. Currently ongoing now is the celebration. So out there we have our mother's class and also party for our NICU graduates. So it's ongoing right now. And I know in several places in the Philippines, they also celebrate the World Prematurity Day. So this would help us to raise awareness on preterm birth and also on the preterm birth challenges and shine light on the risk and impacts faced by the preterm infants and their families. So a premature baby is one who has had a rough start in life, but survive and thrive because of their strength. They are little fighters and deserve to be celebrated for the amazing things they have endured. So happy World Prematurity Day, everyone. So that would be all. Thank you.
Thank you so much po, Doc Guzman, sa pagbibigay po sa amin first ng datos, no? Mga kampanya na ating isinasagawa as we celebrate the prematurity in our country. And most importantly, the PhilHealth benefit for premature and small newborns aligned with our universal healthcare law that aims to ensure the delivery of quality of health service for the Filipino mothers. So, Doc Uy and Doc Guzman, hindi ko na po patatagalin at tayo po ay tutungo na sa huling bahagi ng ating kapihan na Q&A portion. We received here a question for Dr. Uy. The question is, what are the key lifestyle factors and prenatal care measures that can contribute to prevent premature birth?
Okay. Some of the lifestyle factors or risk factors that may be associated with delivering a small baby or a premature baby are the following: smoking and alcohol intake. That's why we have to encourage stopping smoking, cigarette smoking and alcohol use during pregnancy. We have to make sure that the pregnant woman continue daily exercise, continue to have good nutrition, and very important is early and regular checkup. The adequacy of checkup now, I think right now the recommendation by DOH is already 8 times during the pregnancy from a previous 4 only. This is really to closely monitor the pregnant women if they will have any risk factors for preterm delivery.
Thank you very much po, Doc Uy. The second question is for Doc Guzman. With the programs that you mentioned or we discussed earlier, how can you say that these are effective in reducing preterm births?
Yes. So these programs, there are several programs actually that were launched by the Department of Health. So in collaboration also with the World Health Organization and the UNICEF. So these programs, when the essential newborn care protocol was what do you call this endorsed, at the same time the strategy for the maternal, newborn, and child health and policies were implemented. So what happened is there is a reduction actually in the preterm mortality rate. So before, the Philippines is one of the top 10. So currently the latest data from the WHO UNICEF, di na tayo kasama. So I guess that's a good sign also. At the same time, the preterm birth rate decreased or also. So currently it's only 7.7%. So that means 7 preterm births in 100 live births. So in contrast to the previous data na 13.3%. So ibig sabihin 13 preterm births in 100. So with that, the strategies was mainly on educating the healthcare workers. So to give quality care. So because that is really important to manage prematurity.
Next question is for Doc Uy. Do you think or how can community-based awareness program help in educating the public about the risk, the consequences of premature birth, and what role do the healthcare professionals play in this initiative?
Actually, information dissemination and education should not only be limited to pregnant women, but all women of childbearing age, as well as their families. Because having a preterm infant is a concern and affects the whole family as well as the community, since these infants may need more resources in the hospitals, in the clinics, may need special government services as well as special education so that preterm awareness, like celebrating the preterm day today, may be one of the ways, but I think it should be included in regular dissemination, in the school curriculum, and to really make the community aware that prematurity with its complication is a major cause of death among neonates in the Philippines. Now, the health professionals like us in the Newborn Society can help educate as well as advocate for guidelines and policies to safeguard the pregnant woman and the premature infant. So right now, as what we're doing is we have programs for neonatal resuscitation, which will help the preterm infants. We are now leading the Care for the Small Baby program. This is we're disseminating this to all DOH hospitals so that in the periphery or outside the metropolis, the health providers are also aware and can manage the small babies. And hopefully, with the health providers having been trained, this will actually be disseminated to their communities.
Thank you very much po, Doc Uy. The second question is for Doc Guzman. You mentioned kanina po, no, yung mga ginagawa ng government for this to prevent the prematurity. Ang question po is, meron pa po ba tayong collaborations aside from the government agencies to non-government organization, private sectors to support and implement programs addressing prematurity in our country?
Yes. So, as mentioned kanina nga ni Dr. Tita Uy, so our society is one of the one tapped by the Department of Health for the care for the small newborn, which is actually a training program for other health professionals in the country on how teaching them on how to handle the care for the newborn infants. At the same time, the Department of Health also collaborated with the WHO and UNICEF. However, regarding addressing the prematurity in per se, I guess we have to exert more efforts or build more programs to really reach our goal in decreasing the preterm. Pero as of now, of course, the DOH has been collaborating with other agencies. Thank you.
Thank you so much, Doc Guzman. Yung second question naman po is, with all this initiative and what is the role naman po ng technological innovations and telemedicine to be utilized to improve the monitoring and care of pregnant women at risk of preterm labor? I think Doc Uy can answer this. In what
Okay.
ways can
Yes.
yes.
Actually, I attended a seminar at the PCHRD. There was a group of, I think it's a Japanese company, wherein they have a point of care device, wherein the small device can be brought by the pregnant woman, and it can actually detect contractions, and the tracings can be transmitted to the doctor's office through the cell phone, etc. So I think that is one of the ways one technological innovations that we may have to use, especially in far-flung areas where there is not enough health providers. So that what will happen is that with that technology, then the doctor may be able to determine if the mother is in early preterm labor or about to deliver, and will be able to advise the mother accordingly. With regards to telemedicine, the National Telehealth has this RX box, and I know it is used not for pregnant women but for other conditions like high blood pressure. I think this can be tapped because a lot of pregnant women may have high blood pressure, or what the term is preeclampsia, which is also a risk factor for preterm delivery. So I think that is we can tap also the National Telehealth with regards to this telemedicine and technological innovations.
Thank you very much po, Doc Uy. We are now we have only last two questions po for each of you. For Doc Guzman, how does our country collect and analyze data related to prematurity, and what measures are in place to ensure the accuracy and reliability of this information po?
To be quite honest, I don't have any idea how the Department of Health really collects the data. So all of the data that I have presented were from the UNICEF, WHO, Lancet, and other NGOs that are that are actually on prematurity awareness. So actually, I really don't know if how per se the DOH really collects how they collect the data.
It's okay po, no worries. Sure po. Go ahead, Doc Uy.
Yeah. Yes, Dr. Christine, if I could just add, I've attended some meetings with the DOH, and they have this epidemiology bureau, which is now collecting data. Hopefully, it includes prematurity data. But what is new now is in the Philippine Pediatric Society, isn't it, we have a registry of diseases. We have already added what is called a newborn registry. But of course, this is limited only to the training hospitals accredited by the Philippine Pediatric Society. So in the capacity of the members of the PPS, the hospitals are submitting data on newborn registry, which includes preterm data. So I still am not, I have not analyzed or I have not seen any analysis or results from these databases.
Thank you po, Doc Uy. Thank you din po, Doc Guzman. The last question is also for you, Doc Uy. What is the role of a regular citizen play in promoting policies and initiatives that address the issue of prematurity? Kaya nga po ng sabi po nila kanina, no, itong usapin na to hindi lang para dun sa mga nanay na magdadalang tao, kundi para din po sa lahat. So, ano po yung sa tingin po ninyong role na dapat gampanan din na kahit normal na citizen lang po to promote the policies, the initiative to address the issue of prematurity?
Actually, in the Philippines, we are lucky. There's a lot of advocacy groups, like breastfeeding advocacy groups. I think there are also, for instance, there's, for instance, a Down syndrome parent group. So I was thinking probably the parents of preterm infants, because we have a lot of preterm infants, can actually have an advocacy group, because there was an attempt in one hospital to do this, because this group will actually become the support group of mothers whose babies are still in the NICU, suffering the preterm complications. And as an advocacy group, it would have, I think it will be stronger if it will call for changes in policies or advocate for policies to protect the mother and the infant. One of the ways would be, for instance, asking for provisions for transportation, living allowances for the mothers so they can continue to provide KMC in the hospital and at home, or advocate for spaces in the hospital where the mother and the baby can stay to be able to implement the KMC. So I think if we have an advocacy group on of mothers of preterm baby, I think this will be a very strong group that can change policy here in the Philippines.
That's correct. Thank you so much po, Doc Uy. That is the last question po, ano. But before we officially end our Kapihan session today, may I ask for your takeaway messages po? I think unahin na po natin kayo po, Doc Uy, then Doc Guzman.
We're so close already to the SDG goal of meeting at least as low as 12 neonatal deaths per 1,000 live births. We're now at, I think, as mentioned by Dr. Christine, 12.3. So we have to continue pursuing and advocating for improvement in preterm survival so that we will at least be able to reach this SDG 3 in the Philippines.
Thank you so much po, Doc Uy. Go ahead po, Doc Guzman, for your takeaway message po.
Yes, prematurity is the leading cause of neonatal death in the Philippines. So it is possible to improve the survival and health of the preterm newborns by having high coverage of quality antenatal care, skilled care at birth, postnatal care, and care of the small babies. So by raising also awareness, we can also take action and improve the outcome of the premature babies. At the same time, we also celebrate the strength and resilience of the premature babies and their families. So, thank you.
Thank you so much din po, Doc Guzman. Muli, salamat po, Doc Uy and Doc Guzman. Gayun din po sa bumubuo ng Philippine Society of Newborn Medicine at Philippine Children's Medical Center sa pagpapaunlak po ninyo sa aming imbitasyon na aming kayong makasama sa Kapihan with Media ngayong araw. Sa Ating mga tagapakinig, lagi po nating aalalahanin na naririto po ang kagawaran ng kalusugan hindi lamang po para masigurong healthy ang bawat Pilipino kundi sapat rin na kaalaman sa iba't ibang mga sakit, paano to maiiwasan o di kaya ay paano maibabatid ng gobyerno ang mga serbisyo sa bawat Pilipino. Mula noon hanggang ngayon, ang kagawaran po ng kalusugan ay nagpapasalamat sa aming mga media partners sa patuloy na pagiging katuwang sa pagpapalaganap ng tamang impormasyon pangkalusugan. Muli, ang inyo pong lingkod mula sa Kagawaran ng Kalusugan. Ako po si Linda Gerteja at magkikita-kita po tayong muli sa susunod na Kapihan with Media. Maraming salamat po at sama-sama tayo sa isang healthy Pilipinas kung saan bawat buhay ay mahalaga sa bagong Pilipinas. Happy World Prematurity Day!
Thank you and happy World Prematurity Day.
Yes po. Thank you so much, Doc. Thank you so much din
Thank you.
po, Doc Guzman.